Okay, welcome everybody. So this presentation is an overview of the changes that are happening to the long-term care MedRec processes with a specific focus around transfer MedRec, as this is the area that will be changing for us very shortly. So I hope you're all aware that we do have a regional MedRec policy. And so this was first introduced way back in the spring of 2016. So it's hard to believe it's actually been 5 years since the WHO first created a med reconciliation policy. It was recently revised in September of 2020, and we had circulated that to sites just in April, as well as with the MedRec package that went out earlier this week. In terms of revisions to the policy, there was really no significant changes to the long-term care sector. So the revisions that were made really focused around ambulatory care and the primary care environment, as well as some more patient-centered language was incorporated into this revision. Where we're really going to focus our attention today is around the long-term care MedRec procedure. So again, the original version was developed back in 2016, and we have done an overhaul to it just this month, and that went out in the package. So this is what the procedure looks like. It's a screenshot of the kind of header of the policy or the procedure. And again, it links back to the policy. So the policy indicates that there's different procedures for the different sectors. So acute care has their own procedure, community has their own procedure, and we in long-term care have our own procedure. So with these changes, there's really two areas that have significant changes within the procedure, and that is the admissions to long-term care from an acute care facility, as well as the return transfer from an acute care facility. So if we keep that in mind, it's really the people that we're receiving from hospital. So whether they're new to us, a new admission, or they're one of our residents who are returning after being admitted to acute care, this is where our processes really change. There's really been minimal changes to the other sections, but just as a reminder of what those are. So our admission to long-term care from community or another long-term care facility, so that's not changing. So we'll continue to document our best possible medication history on our long-term care admission MedRec form, which hopefully you're all familiar with. So again, that involves the collection of information sources and creating that best possible medication history and transcribing it onto this form. So that process is staying the same. In terms of our procedure to transfer to another facility, so when we're sending a resident primarily to acute care or to another facility for admission, our process is staying the same with using the copy of the MAR with the MedRec label, which I've included here, as a representative of that best possible medication history. So again, that process is staying the same. And in the relatively rare circumstances where we have a discharge to the community, although more common in some places than others, such as the TCU at Misericordia, our process is again staying the same, and the pharmacy can generate this medication reconciliation report, which serves as both a discharge MedRec as well as a prescription. So again, that process is staying the same. There's just minor updates in each of these sections. So where we're really focusing today again is on that transfer from hospital or acute care and what's changing. So in particular, when we're thinking about transfers from the WHO acute care sites, which is the majority of our transfers that we do on a day-to-day basis, what they've been doing up until now is printing off a transfer MedRec form from their MedRec application, and we've been receiving it and using it as an information source. So one of the key changes that's happening is that MedRec application that they're using to generate that form will be doing an upgrade. So right now that's scheduled for June the 9th. So that's kind of the time frame that we're working on right now. So if that goes ahead on June the 9th, then people that you're receiving from hospital after that date will likely have a new looking transfer MedRec form. And so that's what the sample on the side here is. And so that's when we'll be launching this new format of the form. And we'll go through the different sections and how it will be different. So what we want to keep in mind throughout this is really we're shifting our focus from that of being primarily a transcription role for the nursing staff that are receiving the MedRec to really focusing on that reconciliation part. And the concept of reconciliation is really doing that comparison of all the different information sources and distilling it down to one complete med list. So we want to keep that in mind. And it'll be a bit of a change in mindset for our nurses, but going from more of a transcription focus to a reconciliation focus. So what are some key new features of this transfer MedRec form? Well, the biggest thing is you'll notice that there's this new set of columns on the right-hand side of the form labeled as receiving orders. And so what that allows us to do is to be able to do reconciliation right on this form. So whereas before we had the columns on the left-hand side of the form, which the hospital transferring prescriber would complete, so that hasn't changed. But then we'd have to copy out all these medications onto one of our either our admission form or our transfer form and have to do our reconciliation that way. Now what this is allowing us to do is our prescribers can then indicate their receiving orders right on this form. So now we don't have to transcribe any of these printed medications onto a different form. So hopefully this will make the transfer MedRec process much more streamlined for you on the receiving side, as well as easier for the prescriber and the pharmacist to be able to review and interpret those orders. So we'll talk a little bit about really what the role is when we receive these forms. So in your package that went out earlier this week, there were sample MedRec forms. So these are really key things to follow along with. So there's the transfer MedRec form, the sample. Generally, it's about 3 pages. It can be longer depending on the person, how many medications the person is on. There's generally 4 sections to this form. There's all the scheduled medications that the person is on in hospital, all their as needed or PRN medications the person is on in hospital, medications that they were on before going into hospital that need to be accounted for, and then the transferring prescriber may have any newer changes. So these 4 sections are the same as they've always been on our form. The key piece again is these 2 new receiving order columns, as well as you'll notice on the bottom it's been split in 2, and there's a receiving side and a sending side or transferring side. So we'll be primarily focused on this receiving side. And then the new form that we've introduced is this addendum form. And that's really to help us to go along with the transfer MedRec forms from acute care to account for some of the medications during our reconciliation. So in your package, you would have received this sample form as well as a blank version, which should be kept on all of your units as it will be needed as part of the MedRec process. So many of you might be familiar with this existing PCH transfer MedRec form. So once this the new template that has these receiving order columns comes into place from acute care, this existing transfer MedRec form can be destroyed, deleted, burned, whatever you guys choose to do with it. So we will not need this form any longer to do our transfer MedRec. Again, because we will be using the transfer MedRec form directly from the hospital to do our reconciliation and orders on. Just to note that the transfer MedRec form from St. Boniface Hospital does look a little bit different. The reason for this, it's generated from their electronic patient record. So there is a little bit of a different look to it. Generally, though, we follow the same procedure as we do with the WHA transfer MedRecs. So it is called a worksheet, although it's really more of a form. And again, you still have those receiving reconciliation columns. The only difference there being is they do actually have a change column instead of just continue and stop. But other than that, it's very similar and we'll treat it in a similar procedure. Okay, so I'm going to start off on the admission side. So what the thing is with these two new procedures, so there's the admission and the return transfer, is they're somewhat different at the beginning because they have a little bit different information sources, but then the process as we go along really becomes common to both scenarios. So that's how we'll kind of structure the presentation. So just a reminder that our admission medrec does need to be completed within 24 hours of when the resident is first admitted. And where that time frame comes from, it's really from the PCH standards. So you might recall in Standard 7 that a list of medication needs to be provided for the resident within 24 hours of admission as part of that initial base care plan. So our goal is really to collect that best possible medication history, or BPMH. So we want to have the most accurate list of medications we can for that person. And that helps us generate then the admission medication orders. Generally, the person is not known to us very well before they come to us. So that's why we want to start off with getting to know what their accurate medication list is. So our first step in any medrec is to gather our information sources. So in this situation, when we have somebody that we are admitting from hospital, our information sources, there's a few of them that we're going to be getting from the hospital, and there is a little bit of variation depending on how long that person has been in the hospital. But our first three key information sources is, first of all, that completed transfer medrec form. So again, we absolutely need that form to be able to do our medication reconciliation, so that's a very key piece of information. I think generally the acute care sites are pretty good about sending this. One benefit with this new upgrade to the medication reconciliation application that they use is that if they, for some reason, it gets lost or they forget to send it to you, they can actually go back and print it once the person is discharged. So before, in their current situation, they could never once the person was discharged, their medication profile was gone. Now it will actually be retained. So if there's ever a concern or you need it redone or recopied, they can actually go back in and print that off. So the key piece to look for when you're first receiving this transfer medrec form is when was it actually completed. So for admissions, we indicate that it must have been completed within the last 7 days. So there's two different dates that we're looking for regarding this. One is we want to, sorry, this circle's in the slightly wrong spot, but we want to look at the date that the prescriber completed it. So we want to make sure that that's within the last 7 days of when we're receiving the person. And we want to look at the date it was generated. So that's basically the date they printed it from the system. So we want to make sure both of those dates are within the last 7 days so that we can be fairly confident we have the most current orders. We have had some instances in the past where a transfer medrec form had been completed. For some reason, their transfer was delayed, and they ended up sending the original transfer medrec, even though it was several weeks later. And so, unfortunately, that led to an occurrence. So again, this is a good double check. If you find that it's been more than 7 days, in that case, you'd want to follow up with the transferring unit and ask them to please provide an updated transfer medrec form that's been completed and signed by their prescriber. And now, again, as I said, they'll have the ability to go back and do that. The other two key pieces of information that you should be receiving from acute care is the recent MAR from their acute care stay, so preferably the last 3 days worth of MARs, as well as their most recent physician order sheets. So again, the last 3 days. The rationale for the MAR is really to give you guys an idea of how they were administering their medication, so what the timing was, if there's any specific administration information that they maybe had documented on the MAR. So if it was a once weekly medication, you'd know what day of the week they were giving it. So in terms of the physician order sheet, we just want to make sure we've captured all the recent orders and nothing has been missed that was recently added to the order sheet. So those are the first three key pieces of information. If the person's been in the hospital for a long time, so more than 90 days, we're not as interested in what they were on when they were at home. because, it's been 3 months, right? If they haven't been on any of those home meds now, really we say that what they're on now in hospital is really their best possible medication history. So that it is a benefit to us to really just focus on the medications listed on the form. So in that case, all we have to do is then, really this is our basis and starting point, and then we can review it with the prescriber. There's less need to really look at other information sources in this case. So again, for people that were in hospital for more than 90 days. If they were in hospital less than 90 days, then there may be things that they were on at home or prior to admission that we want to make sure, does this medication need to be restarted? Was it stopped? What was the reason it was stopped? Some of that kind of rationale. So that's when you'll receive these additional 2 documents from acute care. So you should receive their admission medrec from acute care. So their admission medrec form is printed from their application, and it looks like this. So then medications are populated, the names are populated, and then the instructions are filled in. And then there may or may not be one of these addendum forms or therapeutic substitution forms, depending on if any changes were needed to be made. So one benefit of having this is this allows us to see what were they on prior to admission, and do any of those medications need to be accounted for at this time. So we've gathered our information sources. We know that there's 3 key ones all the time that we have for transfer medrec. And if they've been in the hospital a shorter amount of time, we have those additional 2 in terms of the admission medrec. Now we need to really look at all of those documents and reconcile them, which is really just comparison. So if you think of it back to that matching game you might have done as a kid, we want to make sure all the medications are accounted for and have, so we can allow the prescriber to make a decision about them. So the medrec form is really kind of our basis, and then we want to make sure that we're referring to these other information sources to reconcile the medications. So as part of that, we want to identify, is there any medications that were missed? So something that they were on at home that they weren't on in hospital. What happened to that medication? Do we need to restart it? Or there might be situations, again, when you're looking at those order sheets over the last few days, is there anything that's not captured on that transfer med sheet? So if their medrec was printed, 6 days ago, but the physician made a change 3 days ago, we want to make sure that that new change is captured. And then our next step after we've identified the omissions, we need to document them. So where those go is on this new form, so this addendum form. So basically it's just an extra form added to that transfer medrec form to ensure that we have that complete list of medications. So again, you have both a blank and sample copies of these. So again, these need to be available on your units to go along with the transfer medrec form. This form has 2 different sections. You'll see screenshots of the different sections a little bit later, but generally there's a section for pre-admission medications that weren't ordered in hospital. So is there something they were on at home that now they need we need to decide if we're going to restart it or stop it. And then the bottom section is for new orders by our PCH prescribers. So we'll come to that in a little bit. And so just a reminder that when the nurses are documenting medications in this section, we need to follow good medication order writing standards by documenting the medication name, dose, route, and frequency. And then for something like a once a week medication, it's also a good idea to indicate what day of the week they were taking it. So after the nurse has done all this reconciliation between the different information sources, documented any omissions on that addendum form, they need to sign off that they've done that reconciliation. So there needs to be some acknowledgement of who actually did that process. So there's 2 sections that need to be signed. So on the first page of the transfer medrec from the hospital, there's a section in this red box down here that says reconciliation completed by receiving site. And so that's where the nurse would sign that they're the ones who did the reconciliation, including the date and time. And then on the addendum form, they would indicate on the bottom of the addendum form, there's a similar box again, who had done that reconciliation. So those are the two spots that the nurse needs to sign upon completing the reconciliation. So now we're going to talk a little bit about return transfer from an acute care facility, and then we'll come back and talk about contacting the prescriber and the prescriber piece in a little bit. So again, these are residents who are known to us. They've previously been admitted to our facility. We needed to send them to an acute care facility for some reason. They've been admitted, and then now they've come back. So just a point of clarification, because I still actually receive quite a few questions about this, is if one of our residents goes to an emergency department or an urgent care and they come back without being admitted, we do not need to do a med rec. So some people still get caught up around some of those time frames that we used to have, 24 hours, 72 hours. Those time frames have been completely eliminated, and that's been the case actually since 2016. And so if they don't get admitted to the acute care, we don't need to do a med rec. In that situation, there should be some communication from the emergency department or urgent care about any medication changes that are suggested. What would happen then is then you would communicate those to the PCH prescriber and document them as a new medication order or change in the prescriber order sheet, as you would for any other order that you were taking from a prescriber. So that's our process for when our residents aren't admitted and they come back directly from the emergency department or urgent care. So if they do get admitted, regardless of the time frame for admission, this is our process that we need to follow. Our goal is really to ensure that we're comparing the acute care transfer med rec from the hospital with their previous long-term care MARS. We'll remember that when we sent the MARS to the acute care with them, we said, this is their best possible medication history. This is everything that we're giving them at the personal care home. So we want to make sure that all those medications are accounted for when they come back to us. So again, the first step in the process is really to gather those information sources. So it's very similar to the process that we saw with the acute care admission when it was a shorter duration admission, is there's the 5 key documents. Although number 5 you may or may not receive depending on if it was needed. So again, our key is really that transfer medrec form. What we say for this, though, is that it should be completed within the last 3 days versus 7 days, because we know when somebody is waiting for admission, generally that's a little bit longer process, so they're stable usually for longer. Whereas with an acute care admission or return transfer of our existing resident, they may not be stable as long before coming back to us. So we want to make sure this transfer medrec form is as current as possible. So again, we're going to check those 2 dates that I mentioned before. When did that transferring prescriber sign it, and when was it printed, or the date generated in the bottom right corner. The copy of the MARS and the order sheet, physician order sheets, are exactly the same. So within the last 3 days, for all the same reasons we already talked about. So the MAR to see when they were giving medications, how they were timing them, and the physician order sheet just to make sure that there hasn't been any changes since that transfer medrec form was printed. We also, because it's a shorter admission, we also should be receiving a copy of their admission medrec, which we hope will reflect our PCH MAR, because that's what we would have sent them in order to do the admission medrec. And they may or may not have some of these addendum forms depending on if there was any changes to their medrec. Okay, so our next piece is to move on to the reconciliation phase. So with our return transfers, the really key reconciliation we need to do is between the transfer medrec form and the previous PCH long-term care MARS. We also will have some of those other information sources, but really these are 2 key pieces to reconcile. So you want to have both of them in front of you. And again, reconcile is just a fancy word for, comparison, matching, however you want to think about it. So we just want to go one by one through the list on the transfer medrec and make sure all the medications from their previous MAR are accounted for. The other piece we want to do as we're going through that reconciliation is we want to note if there's been any dosing changes in terms of a medication that they were previously on but has a different dose since coming back from hospital. This will really help key the physician or the prescriber, as well as if you're doing the prescriber review by the phone, so that you can say this person, was on metoprolol 25 twice a day in the hospital, but this is a dose increase for them. This will allow the prescriber then to make an informed decision about what to do with that medication going forward. So again, the next step after we've documented those dose changes is to identify and document any medications that were omitted. So what we're primarily looking for is there medications that were on their PCH MAR that is not currently on the transfer MedRec form from hospital. So the hospital may have had various reasons for not continuing those medications at the time, but we want to make sure we reassess them when they return. So in similar to what we did on the admission side, when we document the omissions, it goes on this addendum form. So we would write, these are the pre-admission medications that weren't ordered in hospital and are not reflected on the transfer MedRec form already. So and again, using those good medication practices for writing orders and including the name, dose, route, and frequency. So, and then finally, that reconciliation needs to be documented as to who performed it on the first page of that transfer MedRec form in this box, as well as on the addendum form in a similar box on there. Okay, so now whether we have an admission or we have a return transfer, the next step is really to contact the prescriber. And so the situation with the prescriber, it's the same steps regardless of which process we're using, if it's an admission from acute care or the return transfer from acute care. So all of you will know how your physicians like to be contacted. Some like to be contacted by phone, some like to be faxed. So if you're sending the MedRec form to them by fax, you want to make sure you're sending that transfer MedRec form after the PCH nurse has done the reconciliation. So they should have gone through all the different information sources and signed the form before sending it on to the prescriber. We need to ensure that we send the addendum form. So if you've documented any omissions on the addendum form, we also want to make sure to send, so if there was no omissions that you had identified during the reconciliation, we want to actually still send a blank copy of that addendum form in case the prescriber has new orders that they want to document. Otherwise, they wouldn't have any place to document that. So again, if you're faxing, you want to send the transfer MedRec form. You want to send the addendum form regardless if it's blank or there has medications documented on it. You want to send them the other information sources so they can see some of the documentation from the hospital as to what happened with some of the medications. And just a reminder, if it's a new admission and they don't know the person, generally I think they appreciate getting this change in resident status form because it has the list of diagnoses on it. So we have that section on that MediSystem change in resident status form. So these are the key pieces that you need to send to the prescriber if you're faxing them, and then you would just wait for their response. If you're reviewing the MedRec with the prescriber by phone, we want to make sure we go through all the individual sections. And so we break it down into, there's kind of 5 different sections that we need to go through with them. The first section is really all these printed medications on the MedRec form. So the ones that are actually typed out, they're divided into 2 categories. There's a scheduled medication section and then a PRN one, which I'll show you in a second. And you'll note on each of those, there's 2 columns under receiving orders, one that says continue and one that says stop. You'll note there's this little notation under receiving orders about new orders being written on the prescriber order sheet. For long-term care, we can actually ignore that because we have our addendum form. So we have a spot on our addendum form where new orders can go. So You'd never have to document any of these on our regular prescriber order sheet. So you can just ignore that piece. And then there's the as needed section. So again, these are our PRN medications, and there's a box to continue or stop. As you're speaking with the physician, it's generally a good idea you want to indicate the medication you're talking about, as well as what the transferring prescriber indicated. So you want them to have all the information. So you'd want to say, acetaminophen, 650 milligrams, PO 4 times daily, the transferring prescriber indicated to continue. So it's good for them to know that information because there might be situations that you'll see on the sample. A good example of that is dalteparin. So on the sample, the transferring prescriber indicated for it to stop. And so we'd want to communicate that to our prescriber generally they will agree to stop that medication. There may be situations where they don't agree. So that's why it's important to know that. The second section that you're going to go through with the prescriber is, again, on the transfer MedRec form from the hospital. The hospital will have documented any of the medications that they were on prior to admission that weren't started in hospital. So again, this is part of their reconciliation that they should be doing before the person comes to you. So they should be looking at their transfer MedRec form and the admission MedRec and doing that comparison. If there's no medications that they were on prior to admission that they aren't on in hospital, then they should be checking this box and initialing here to indicate, that they've reviewed the BPMH on admission and that there was no other pre-admission medications to consider. In this situation, we do have some that they've indicated. So in this case, the person was on nifedipine prior to admission. They've indicated to stop that because there's a change to amlodipine. So we'll see that in the next section. They were on some iron, some ferrous sulfate. They've indicated to restart it. And they were on some omeprazole, and they've indicated to stop it because now they're on pantoprazole. So we would have seen that pantoprazole order earlier on in the MedRec. So in this case, our prescribers can restart or stop the medications. So they may have various reasons for doing one versus the other. The third section, again, still on that transfer MedRec form we get from the hospital. The transferring prescriber from the hospital may have documented new medications or medication changes at the time of transfer. So this would be the hospital documenting this. And then we need to communicate these changes to our prescriber, and they can indicate if they want to continue or stop them. So we saw in the last section that the person was on nifedipine before hospital. They don't want to restart the nifedipine. They want to change it to amlodipine. So then we see the amlodipine order down here as being new. Earlier in the sample MedRec form, if you look on the full sample, you would see that the allopurinol was indicated to be dose adjust for renal function. So they were on a higher dose of allopurinol in hospital, and now they want to lower it due to their kidney function. And so they've written this new order here. And so again, our prescribers need to decide if they're going to continue or stop. So that's really the hospital documentation piece. So reviewing everything that the hospital documented with the prescriber. Then we get into the addendum form. So this is the form that your nurses would have completed as part of their reconciliation. Again, if there was no omissions, they may not have anything in this section, and then you don't need to indicate anything. But if there was omissions that were documented, so in this case we had 2. So prior to admission, the person was on vitamin D and alendronate. And so we've indicated that order here, but to actually activate the order, the prescriber needs to indicate, do they want to restart it or do they want to stop it? And then the final section is on the bottom of the addendum form, and that's where our PCH prescribers can give new or changed orders. So they may decide on admission or return transfer that they want to start something new. So in this situation, this person came back to us with an itchy arm rash, maybe from their IV cannula. So they've ordered some cetirizine, so an antihistamine, and some hydrocortisone cream for a week for that rash. Earlier on in the sample, we saw the metoprolol. You might remember we indicated that the dose had changed while they were in hospital. Our prescriber has decided, no, I don't think we should go with the higher dose. We're going to stop the higher dose and we're going to order the lower dose. So that's how this section can be used. It can also be used to document for a new admission. The prescriber or your nurse can note if the long-term care medication standing orders are approved. That order can be noted in the section as well. So then the final step really to complete the form is that we need to document that prescriber authorization. So if the prescriber if you faxed it to them, they should be checking off all the applicable boxes and sending it to you signed. They do need to sign every page of the transfer medrec form as well as the addendum form. So it's a little bit different than the nursing signature, which was only on the first page of the transfer medrec. The prescriber signature section is on every page. So and the same goes with if the nurse is taking a phone order from the prescriber, as we have in this sample, it needs to be documented on every page, as well as on the addendum form. So again, the sections look very similar. They're on the right-hand side of the transfer medrec form and along the bottom of the addendum form. Okay, so our transfer medrec form and our reconciliation is complete. Those are now considered official orders, so admission orders or return transfer orders. Before we file them away in the chart, we need to do a few more things with that form. We need to fax it to pharmacy. So the documents that you want to send to pharmacy is, of course, that completed transfer medrec form. You want to send the addendum form in case there's any new orders or there's any medications that weren't accounted for, as well as the information sources that were used to complete the medrec. This can help the pharmacy just make sure that there's nothing that was missed. The MAR is also very helpful for them when determining when to schedule medications. So that's a really key piece of information that should go to the pharmacy. Whoever is sending this fax to the pharmacy should indicate with their initials, date, and time when they sent it. And then the last piece, which you may have varying site procedures around, is really the order processing step. So again, you may have different ways of doing order processing, but if your nurses indicate that they have transcribed the orders onto the existing MAR in the interim while waiting for the MAR potentially to come from pharmacy, they can document that under transcribed by. And then some sites do a double check of the medrec by a second nurse in terms of the transcription and potentially the reconciliation, so that nurse can sign initial here and put the date and time. So again, this section may or may not be used by your site, but it is on each of the pages if you do have an order processing procedure. At the very end, we want to then file the completed transfer medrec, the addendum, and the addendum form in the order section of the patient health record. Again, because these represent our admission orders or our transfer orders. And just a reminder that the medrec form should not be removed or thinned from the chart. It should be a permanent part of the health record. But the transfer ones, the return transfer medrec forms can be thinned if the chart gets too large. So just as a summary, the medrec steps we want to keep in mind is gathering all those information sources, doing a comparison, which we call reconciliation, of all the medications on those sources and determining what is really the most accurate, best medication list for that person. We want to identify and document any omissions that we find so we can figure out what to do with them and account for them. We want to communicate this information to the prescriber, whether that's by fax or by phone. The prescriber is going to order the medication. And then finally, we need to fax and process the medication orders in order to have the medications arrive and to have them accounted for on the MAR. So one of the other documents that was included in the package that I just wanted to highlight was this overview of long-term care MedRec. So in this diagram, it outlines kind of the general steps under admission, transfer, and discharge. Sometimes it can be a nice visual for people that are, they find it easier to follow something like this than maybe the written procedure. So it can be a good tool for your nurses to have available. It goes through kind of what our goal is for each section, the different information sources depending on, in this case, where the admission's from, some of the questions we need to answer, and to determine which pathway to go down and which forms we need to use. So similar to the transfer MedRec as well as the discharge. So again, just a nice visual diagram for your staff. So just to review, so as part of the implementation package that went out earlier this week, there was the revised WHA policy on medication reconciliation, the revised procedure, and so we've gone through the key points of change, which was really around that admission from acute care and transfer from acute care. We have included a couple sample forms, which those are the screenshots you've been seeing throughout the presentation. So we have a completed transfer MedRec form as well as a completed addendum form. The addendum form is also included in blank version, again, because you'll need to have hard copies of these available on your units, and the overview of MedRec diagram that I just showed you. So those are the different documents that came in the package. And so our goal is really by June the 9th to provide education to as many of our nurses as we can who are involved in the MedRec process. So these would probably be primarily your daytime and evening nursing staff, you know, with a focus on your kind of regular staff that are doing this all the time. In terms of education resources, so really this webinar, as well as a lot of the resources, are focusing again on just the changes. So they're really designed for people who are familiar with the current process of MedRec and just need this refresher information about the changes. So we have this webinar, which we delivered yesterday, and then today we are recording this webinar, so we'll make that link available. I will also share this PowerPoint presentation so you can either give it to your staff to review or run more sessions with your own staff. We're developing a prescriber order sheet, information sheet, sorry, which will highlight the key information that the prescribers need to be aware of. And then one thing we're kind of trying new this time is that the long-term care pharmacist, Connie Vines, is also available to help support you in this implementation and can come and do on-site presentations or huddles. We also talked a little bit about, after yesterday's session, you know, developing like a sample, like a practice one that your nurses can walk through. So we'll provide that to you, as well as Connie can come and work through that with your nursing staff and answer more questions. So again, that's available to you, and you just need to reach out to request that with her. And then we have this overall MedRec orientation presentation, which is really for your brand new nurses to long-term care. And so we're going to update that as well, so that as you onboard new nurses, it goes through the whole spectrum of MedRec, all the way from, you know, your admissions to community, to your transfers out, to your discharge. So it'll have these new sections as well as updates to the original information.